Doctors are helping women who thought they could never become pregnant start their own families. Fertility medicine is advancing, making the option of motherhood available to more women. Joining us now is Dr. Moshe Perez of Boca Raton Regional Hospital to tell us much more. First of all, doctor, thank you so much for joining us.
Thank you for having me.
Let's talk about in vitro fertilization. What is that?
In vitro fertilization actually literally means uniting the sperm and the egg in a small dish in the laboratory.
Okay, a very important step for some couples. Let's talk about the process couples have to go through for this procedure.
It's a fairly involved process in which they have to change some of their nutritional preparation for the procedure, making sure that they are in good psychological health, and to make sure they take in the proper nutritional support before they even start with the in vitro fertilization process.
Absolutely, and that's what you should be doing before even considering this. Getting to this point, though, what can cause infertility?
In about 40% of the time, the problem is related to the male, and the other 40% is related to the female.
Okay.
In about 20%, it's a common problem, both husband and wife.
Okay, but obviously this is an option that can help out in some of those cases. Does this involve surgery? What's this process all about? How is it performed?
The procedure itself is done actually in the office environment. It's done under IV sedation, so it takes usually about 10 minutes or so to complete.
Okay, not long at all.
Not long at all.
Can you tell us about the new advancements in vitro fertilization?
Well, literally there are some ways that we can actually select the embryo, the proper embryo for transfer, because some of the problems that we are experiencing right now is that we have too many twin pregnancies. So we're in the process of trying to select one embryo which is healthy for transfer, eliminate the risk of having multiple pregnancies. And one of the new equipment we have is basically a CO2 laser that we help the embryo create an opening there to help it hatch and attach to the woman's womb.
I know it depends on each couple, but sometimes couples can go through several of these processes. Is that what you're saying?
I think that on a national average, it takes about 3 cycles to produce one baby.
Okay, but once you produce that one, it can be a happy. Is there anything else we should know about any couples that are considering this in vitro fertilization?
Yes, I think that they have to understand that they have to improve their lifestyle in terms of yoga, walking, biofeedback, nutritional support, and understanding that the process itself is a process and it's not really related to one particular treatment event.
Okay. But patients can pay off.
Absolutely.
All right, doctor, thank you so much for joining us. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor segments.